So, for example, even with when I was working in the obesity prevention program as a nutrition health educator, I brought a health equity lens in that program by actually changing the name of the program. So we were for a long time internally kind of known as the obesity prevention program at the county. And I was like, well, obesity itself to me is so stigmatized and stigmatizing for populations. And, we utilize that BMI scale and that's very biased and all of these things that come with obesity as a term. And I said, how about we transition that name into something that's a little bit more inclusive and lets people know that, hey, like we're not just sitting around telling you that you're obese, you need to eat healthier and all of this, but it's really about everybody needs access to healthier foods. Anybody can access this program. And we don't want to feel like we're targeting folks who might already be feeling a way about their weight or what have you. So we went on this process to change the name to the Nutrition Education and Active Living Program. So I think me bringing in that equity in that way was really impactful.
Hey friends, welcome to Public Health Careers. I'm Omari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Nkechi Michel. Nkechi is a human service program planner in the Maternal and Child Health Adolescent Health Program in Sacramento County. She's a passionate public health educator and program strategist with over a decade of experience in health education, grant management, and community-based programming, particularly focused on maternal health, nutrition equity, and chronic disease prevention. She earned both her Bachelor of Science in Community Health Education and her Master of Public Health in Health Education from California State University, Northridge. In today's episode, you'll hear and learn more about the importance of community engagement for effective health education by listening to communities' needs, aids in successful program development and implementation, the importance of language in public health and how it affects perceptions and has potential to affect outcomes, and much, much more. Be sure to hit that subscribe button and enjoy today's episode.
Hi, I'm Nkechi Michel, and I'm a Human Services Program Planner at Sacramento County Public Health. You might also know me as that Public Health Chick on Instagram if you happen to follow that page, and you're listening to Public Health Careers.
Nkechi, welcome to the show.
Thank you. I'm excited to be here.
I'm excited to have you. I know we've been connected online for years now.
Years for sure.
Right.
I'm going to make this happen. I appreciate your, you keep wanting to get me on here. I really appreciate your flexibility.
Yeah, absolutely. I think your story has value and has worth, and I'm happy to have the platform to be able to hear it and share it with others.
Thank you so much.
Oh, it's my pleasure. It's my pleasure. So, jumping into things, how do you identify and tell us a little about your personal background?
Sure. Yes, I identify as a proud Black woman. I'm a cisgendered woman, so she, her pronouns are fine. And a little bit about me. You said just dive into that.
Mm-hmm.
Yeah. So originally, just a little personal background, I guess, from San Diego, California, born and raised down there in SoCal. Right now, I live in Sacramento. Been up here for, I guess, going on about 7-8 years now. Working up here at the county for 6 years. I'm married. I have a 2.5-year-old little boy, and he is my whole world. So definitely a busy toddler mom and a working mom. So yeah, also diving a little bit now into birth work, postpartum work, and lactation work as a career. So definitely excited to have that shift in my career more recently.
And I think I have a question about that later on, but if not, I'm writing down the notes so that we can cover that.
Absolutely.
So, or if you remember, let me know. But okay. I will try not to forget.
No problem.
but I appreciate the background and you sharing the information and sharing more about yourself, and just shifted the the format of the show to just highlight some of the expertise that the guests have before we get more into like the career path. So jumping into some of your expertise as we learn more about and learn how you developed it later on in the show is you've worked extensively in reducing obesity and chronic disease prevalence. What strategies have you found most effective for engaging communities in health education?
Yeah. So I was a health educator in the nutrition education program for a few years at the county. And with that came a lot of community engagement, community outreach, engaging like farmers markets and things like that to increase folks utilizing their cow fresh benefits at the market and increasing access to fresh and healthy foods in neighborhoods that typically don't have that access. So what really helped was really making sure that we're involving the community before we do any decision making processes. So we don't want to go in, we never want to go into a community like, okay, here's what you need. This is how we're going to do it. And just kind of jump in. We always want to say, hey, what do you need? So literally asking the community directly, what do you need? What barriers do you have to accessing, for example, food, right? Healthier foods or nutrient dense foods, right? So going in and saying, hey, like, how do you typically get to the farmer's market? How long does it take you? Do you have transportation? What kind of transportation do you use to get there? What are some things that we can do in this program that can help you get to, for example, the farmer's market more easily, right? What do you buy when you're here? And using that also to identify gaps in that program as well to say, hey, like, okay, we're seeing that 50% of this community takes the bus to get to this farmer's market, for example. So let's go ahead and put some wayfinding signs closer to bus stops to say, hey, there's a farmer's market in walking distance from here, and kind of using strategies like that. But I always say, like I said, like going directly to the community, asking them what they need and seeing how we can really identify gaps, identify barriers, and involve them in the decision making process.
And just highlighting just how important it is to continue to listen to the people that are most impacted and like are you're working to solve the issue for because they're the ones that really
Exactly.
right. And I think that's something that we have to continue to put at the forefront of the work that we're doing in public health as well.
Absolutely. Sometimes we have to take a step back and really let the community lead sometimes, right? And not just, like I said, come in and say, hey, like, we know there's disparities and here's how we're going to solve it. Like, we don't want to, that paternalism really comes into play. So we want to take a step back and, really work collaboratively with the communities that we're serving.
And how do you incorporate a health equity lens into your programs, particularly addressing social determinants of health?
I always bring a health equity lens to every program I've been involved in. So I've worked in sexual health, tobacco prevention, obesity prevention, and now maternal child health. So I really always try to ask the question of like, who are we impacting? Why are we, impacting this? Why are we going towards this priority population? Who else can we get involved with this program? Like always asking those larger questions. So, for example, even with when I was working in the obesity prevention program as a nutrition health educator, I don't know if this kind of answers the question, but I brought a health equity lens in that program by actually changing the name of the program. So we were for a long time internally kind of known as the obesity prevention program at the county. And I was like, well, obesity itself to me is so stigmatized, stigmatizing for populations. And, we utilize that BMI scale and that's very biased and all of these things that come with obesity as a term. And I said, how about we transition that name into something that's a little bit more inclusive and lets people know that, hey, like we're not just sitting around telling you that you're obese, you need to eat healthier and all of this, but it's really about everybody needs access to healthier foods. Anybody can access this program. And we don't want to like feel like we're targeting folks who might already be feeling a way about their weight or what have you. So we went on this process to change the name to the Nutrition Education and Active Living Program. So I think me bringing in that equity in that way was really impactful because, like I said, it really was a little bit more inclusive in that way. And that's just one example.
Yeah, and I think it definitely shifts the conversation from like a deficit perspective to an asset based perspective. And I think we've been having a lot more of that conversation in public health and how we show up in the narratives that we share. And
Right.
like to your point, like we can continue to stigmatize communities by just sharing, okay, you are this community and we're naming you as a bad community when there are so many
Right.
positive attributes and within that same community, and really being able to highlight what and frame things in a sense that it's not even is people experiencing this, or just not stigmatizing them from the language that we're using as well.
Right. Yeah, language is everything. Like you said, people experiencing homelessness, not a homeless person, right? It's like it's just a little language change can really make a huge difference. I agree for sure.
How has your role as a health educator and program planner influenced your leadership style?
Yeah, so as a health educator, I didn't have too much, I guess, too many, I'll say, leadership opportunities. But when I saw them arise, I did try to take them as they came. So, for example, I was able to be the lead for our RFP process that we went through. Um, and I took the lead on that project from start to finish. That was a challenge. That was a real learning opportunity for sure. It really taught me in that moment to know when to delegate and know when to disseminate tasks out to the team. Say, hey, I can't handle all this alone. So, okay, you're going to do this, you're going to do this, but still working very collaboratively. Um, I have a managerial position now. They call it like classification wise, but I don't manage staff. But I would say, like, if I do end up managing staff one day or becoming a supervisor, I never want to be the type that is just telling you what to do and then just kind of backing away. I still want to work collaboratively with my team. So going through that RFP process as the lead really taught me, again, when to say, hey, I need help with this, right? I can't do it alone. And really, I appreciated my team and because we all were able to make it. But I really did have to step up and say, okay, I need to get this done. Let me reach out to upper management because I need their signature on this paper. And then let me reach out to this person and really take the reins on that project. And in my current role, I got to lead another RFP process for our Black Infant Health Program. So kind of the same thing, really. They were leaning into my expertise that I had recently with the other RFP. They're like, hey, you know how to do this. Go ahead and do it all. And I had to be like, well, I can do a large part of it, but I still do need a team to work with, right? And just really learning how to, I guess, balance it all along with my other tasks. So it's a really good learning opportunity.
Yeah, it really seems like you stepped up and understood the importance of building a team and doing this work, and in knowing that just because you're not managing people doesn't mean you can't have a leadership style and show up as a leader within the
Exactly.
work that you're doing.
Absolutely. Absolutely.
And one of the RFPs that you've helped work through, I guess, has resulted in $3 million in funding. What advice would you give to someone that's looking to build sustainable public health programs through grants?
Yeah, you kind of already said sustainability, right? So that language definitely should be in the application process because typically, like a grant cycle will be like 3 years or 5 years or whatever it is. But really making sure language is embedded in there that allows the community-based organization, for example, that might be the awardee, to continue the work that's going to be started within that grant cycle. So, to give you an example, I guess with that, we awarded an organization that focused a lot on the built environment, transportation to and from healthy locations, and transportation and things like that. And so they did a lot of hard work through our grant. They could only get so much done in 3 years. When we're talking about the built environment, you can't sometimes fix the sidewalk that's broken in a neighborhood in that time frame, right? You have to reach out to so many different jurisdictions, and the city of Sacramento has to be involved, and the DOT has to be involved, all of these different entities. So we realized that, and we also, as contract monitors for that grant, as I was in that role, we made sure that in our scope of work, we had to write that language in there too to say, hey, we know you can't do it all, but let's say 5 years from now, you can at least get something accomplished, or 3 years from now, you can at least accomplish this larger goal, but do it in chunks, if that makes sense. So just, I don't know, sustainability language is key. And then just making sure that you are not just leaving them high and dry after the grant ends. Like, you want to be able to give them the tools and empower them throughout the grant process. And yeah, just kind of go from there, I guess.
And how do you ensure that your programs reflect the real needs that communities want, rather than like top-down approaches?
I touched on it a little bit when I was mentioning not just going in and telling folks what they need, but really involving the community directly. So I've done things like, in various programs I've worked in, we've had focus groups, for example. So we'll say, hey, come in and let's chat about what you actually see in your community, what you need in your community, and let's see what gaps we can fill in. Listening sessions have been very valuable as well. So due to COVID, a lot of that has been virtual. So folks would just kind of log in, which is great, and share their experiences. So listening sessions are very valuable. And I know surveys, we do a lot of surveys at the county, which is kind of, they have their pros and cons, I'll say, definitely. But that's another way to kind of engage the community, whether it be virtually or in person. And I know sometimes it's annoying to have us like stop people and say, hey, can you take a survey? And I guess with that too is we don't want to ask the community a bunch of questions and then leave them high and dry. They want to know, hey, what are you doing with this information? Why are you asking me these questions? What long-term programs or activities are going to come from this? So we actually, let's say, for example, we're doing a community needs assessment, right? Where we're asking the community for a bunch of feedback and information. We then follow that up with a full-fledged report, and then we schedule like a town hall meeting, and the folks can come to whatever location that may be, and we can share out the results and say, hey, here's what we're planning to do with the results. We're planning to do X program within these next 3 years, and really take their feedback into consideration when developing that program. So really sharing out, hey, these are the results that we got from your input, and not just, leaving them high and dry after that process is over.
Yeah, that makes a lot of sense, because I feel like people, like, especially during the pandemic, people feel like they were being over surveyed and like under actioned. So it's
Yes,
like they're always asking for information, but not much is like, to your point, not even being shared with them, and then on a larger scale, like not even being implemented around the
right.
things that people are saying. So yeah, it's kind of disheartening in a lot of ways.
It is. And I think, we can't underestimate incentivizing folks. I'm all for incentivizing people for their time. Even when I get a lot of those like newsletters from places I'll shop at, and they're like, hey, take their survey. But I'm like, what's in it for me? Like, are you giving me a coupon or something to come back and shop? Or like, folks want, people's time is valuable. Like, I could be doing 10,000 other things. Why am I going to take a survey for you? Right. So, um, definitely incorporating things like that is important as well.
Absolutely, absolutely. What does public health mean to you?
Public health to me is healthier and safer communities. And at its core, to me, it's prevention. That's what got me into public health. I actually was going to go into nursing. I took all the prerequisite classes. I was, kind of doing the general education classes and things like that. And then I took a public health class. And the teacher was just like, yeah, this is really almost backing it up and saying, hey, we can prevent these diseases from happening. We can prevent these illnesses. We can make communities healthier. That way, they're not ending up at the doctor's office or the hospital or the ER and utilizing healthcare services. So I always say it's like prevention at its core, and it's ensuring that folks are being met, their needs are being met in the communities. So it's community based, it's community focused. And I just love public health so much for that. It's really not waiting for someone to be sick and then treating the illness afterwards. And hey, I'm not knocking any healthcare professionals, they're amazing, right? But really just prevention at its core and ensuring healthier communities.
Absolutely, and not an uncommon path for a lot of people, I think, into the public health realm, but definitely it highlights the importance of I think prevention, and then like that population health or just larger community perspective, which I think is like in my perspective is a better way to think and deal with issues. But unfortunately, funding hasn't gone that way. But neither here nor here. Neither here
Yeah. Oh
nor
my gosh.
yes, yes. I can
Public
get on
health is
my
going
high
through
horse.
it right now.
That is to say the least. That is to say the least. But
Wow.
everyone that's listening to this, you are still valued, you are still rated, and we need you in this work
Do
regardless.
need
So
you. Don't leave public health, please.
yes, yes, yes. So shifting to your academic pathway, or I guess a little bit before your academic pathway, before you started your bachelor's, you were a NICU volunteer at Rady's Children's Hospital and a
Yes.
marketing intern at Chula Vista Center marketing offices. Tell us about those experiences prior to your bachelor's.
So those were way before way before my bachelor's. So do you mind if I actually talk about kind of a little bit more recent experience? So right before, actually, that's okay. I'll go into that. So yes, I was a NICU volunteer because again, I was like, oh, I want to do nursing, so let me get some volunteer work in. And so I was at the time what they would call like a baby cuddler. I don't even think they do that anymore, probably liability and stuff. But I was able to go and like hold kind of the bigger NICU babies, right? And keep them company and talk to them because it's a lonely place in there. Like the parents are kind of coming in and out and seeing their little tiny babies in there. So I was able to get that experience, that hands-on experience prior to when I was gonna go to nursing school. Um, it was fun. I was pretty young. I can't remember how old I was at the time. But yeah, that was a really eye-opening experience. And actually, to be honest with you, that's what led me to knowing that I did not want to be a NICU nurse like I originally thought. It was just a little too dark for me, and then sad. I got really sad. So, and I was a NICU baby at one point. So I just was like, no, I think I'll probably pivot a little bit from that.
Wow, I didn't. That's a cool experience, and I feel like I definitely have heard about the like what was it? What's the title? Sorry, the baby huggers. Is it?
Yeah, they it was like I was just a NICU volunteer, but I want to say they called us like almost like baby cuddlers or something like that. I'm
Love
probably
it.
using the wrong terminology, but like a baby cuddler basically. And we get to hold the babies that were like the less severe cases and just like,
Mm.
make sure that they have that human interaction. It's lonely in there.
Yeah,
It's
that's
sad.
fine. Yeah, that's
Yeah.
fascinating.
Yeah.
Okay, so then I guess going from those experiences and whatever experiences you did have, you went into California State University, Northridge.
Yes.
I'm guessing you didn't start off as with your bachelor's of public health education and promotion. So tell us about the journey and the thought process going into your bachelor's.
Yeah. So going into my bachelor's, like I said, I wanted to do nursing, got more into public health. I'm sorry, are you saying before my bachelor's or going
Like
into my bachelor's?
going into your bachelor's.
Yeah, sorry. Yeah, so again, wanted to originally do nursing, got into public health, took that original public health course after transferring to Cal State Northridge. And from that point on, I just started taking all the public health courses. I changed my major to community health, and it was amazing. Like, I really loved all the classes that I took. I took like community health action, nutrition, adolescent health, just a plethora of classes that were really amazing. So, yeah.
And was the one or the experience that you had being a NICU volunteer the only thing that determined you switching from nursing to public health? And when did that happen in your career, timeline wise?
Um, that was I was a NICU volunteer. I want to say like directly after high school, and then I did like a little bit of retail kind of stuff. I actually ended up getting my associate's degree as well. took all the GEs and all that. So just the general education associates, took all of the nursing prereqs. And, that fortunately helped me then apply those credits and units to later satisfy my bachelor's in public health. So I'm trying to think. I feel like I'm like missing some experiences prior to my bachelor's. I'm like trying to think back. That was a while back in my resume, so I'm trying to think of what else I did prior to. I know I was a peer health educator, but I believe that was directly after my bachelor's. So I might talk about that a little bit later. But yeah, definitely taking like all of the microbiology, chemistry, anatomy and physio, and all of those pre-nursing classes. It actually helped me to kind of see the other side of public health, really. And I was able to learn the terminology and all of that good stuff before actually taking a lot of the public health classes.
And while you were in your bachelor's program, you had three different roles that I'm going to highlight, and you can speak to as much as you'd like or not. So you were a clinical access shadowing experience or case intern at the CLUT Student Health Center. You were a health education intern at Northridge Hospital Medical Center, and you were a senior intern at City of San Diego.
Yes. So the City of San Diego one was actually, that's the one I'm forgetting. I want to say that was before my bachelor's, but let me go into the Cloud Student Health one. So again, at that point, when I'm volunteering at the Student Health Center at the time, I was like nursing. Even when I shifted over to public health, I was still involved in the Student Health Center, and it was a really cool experience. I was able to do a lot of the initial like kind of vital signs for the folks that would come through the door. I would do the blood pressure monitoring, the initial paperwork, guiding the patients and students back to their room, asking them a few questions about, why they're there. Almost like I was an MA, but not really an MA. I definitely wasn't able to do what they did at the time. But yeah, it gave me like a little glimpse into how it is working at a clinic and working in that environment. I'm going to just continue on with the other one you mentioned. So I did also, closer to the end of my bachelor's, I did intern at the hospital as well. And I want to say that was my last semester in school. And I was able to work right alongside both the diabetes educator and then the nurse supervisor. So I did a lot of I'm forgetting the name of it. I want to say it's the class standards, CLAS standards. And I ended up doing like a whole poster presentation on just what those are, how it ties into public health. Don't ask me to mention what those are anymore. That's because I do not remember. But yeah, I was able to do, like I said, a whole poster presentation during one of the conferences there at the hospital at the time, and worked directly under that nurse supervisor, doing just a little bit of research and things like that. So that was a pretty interesting experience as well. And what am I forgetting? You mentioned one other one that I'm not remembering.
Senior intern at the City of San Diego.
Yes. So that's actually, I want to say directly after my bachelor's.
Okay.
I was working there just for a little bit, just to get some experience. Honestly, I was an intern. I worked directly with one of the city council members in San Diego. And it was really administrative, more so, I would say. So answering phone calls, taking down complaints that the constituents had in their districts. I want to say it was District 4. And I got to see kind of that policy and legislative side, actually. I was able to go into like the council sessions and look inside the little rotunda they had during the sessions, like in real time and everything, and listen in to what people really had to say that was going on in their communities, in their neighborhoods. So that was really interesting, I'll say. Yeah, it was a good experience overall.
And overall for your undergrad, what were some takeaways or a takeaway that you wanted to share?
For undergrad, really getting involved, I think, on campus was important for me at the time. I joined like the undergrad, I think it was one of the public health clubs, if you will, while I was taking classes and things like that. So I really got to know a lot of the other students that were in my program. We would share information that's going on public health wise or health wise in the community. So they'd be, hey, there's this health fair going on. Let's all maybe go to it. Or we would try to organize one on campus as well during like, I almost said rush week, the week where folks kind of come to the campus and learn about what's going on, the incoming students. We would help put on like a little table or health fair kind of event for them as well. So I really appreciated that, along with taking my classes. I think that really um, kept me grounded and really helped me appreciate going to Cal State Northridge, because I was a transfer student actually. So at first I did feel a bit disconnected. So I think really involving myself in activities like that was super helpful.
Yeah, and I think that makes a lot of the experience in those early fundamental years. It's like just getting involved and trying to tap into the communities that are there. So, that's,
Sure.
and I believe this position was after your bachelor's, prior to your master's. You were a peer health educator at the Operation Samahan Community Health
Samahan.
Clinic. Okay, I
Yeah.
did say it correctly. So tell us about
Yeah.
that experience.
Yeah. Yes. I was a peer health educator over there for about a year and a half. And so it was a teen clinic actually that I worked at. And I was able to see all the teens that would walk in, and they would come in for a plethora of things, sexual health services, reproductive health services. So we would give free condoms. We would have like little counseling sessions with them in a private room. They say, "Hey, I want to talk about, what's going on." And we would close the door and have a private session with them, provide health education to them regarding, safe sex practices, utilizing condoms, reducing STD transmission, how to talk to their partners about safer sex practices, and all of that good stuff. So, and it was a walk-in basis. So they'd come in also. They didn't necessarily have to get any services, but we had computers for them to use too. So they could just come and hang out, use the computer, and if they happen to need services or want to talk to somebody, we were like an open door. We would have them just walk in, and yeah, I was able to also do a little or a quick HIV rapid testing too, and I became like a counselor for that. Um, and this was under the Title 10 program, if you're familiar with Title 10 funding at the time. So that really opened my eyes even more to public health and actually allowed me to segue into getting my MPH. I'm like, okay, that's how I knew I really wanted to keep going in public health and go ahead and pursue my MPH.
And was there a certain moment or culmination of moments that kind of led to you saying, okay, I would really like to get this MPH degree?
I don't know if there's one singular moment, but I think just the feeling of like, even to this day, like I love that one-on-one, face-to-face, client or patient work. Even in my current role, I wish I had a little bit more of that, where they can just come to me and they're trusting in me, right? That relationship building was there. And they trusted me with such personal information. I knew, like, okay, I really want to do this. I really want to go deeper into public health. And I want to be embedded in the community, make communities healthier, talk to folks, see what's going on in their lives, see how we can break down barriers that might be, causing them not to go to their appointments, or not, like, why aren't you able to use condoms? Is it economics? What is it? Is there no store that has them? So really, I really loved that aspect of, like I said, meeting one-on-one with folks, excuse me, going to the community and really providing health education. I knew I wanted to keep going from that point on.
So, and you pursued your master's of public health in community health
Yes.
education at California State University, Northridge, for anyone that was interested in knowing that.
Yes,
Um,
Susan.
and while you were there, you had a role as a health education and outreach intern at comprehensive community health centers. So tell us a little bit
Yes.
about that experience.
Yeah, that was a cool experience too. Actually, one of my coworkers ended up being my supervisor there. So that was interesting, kind of seeing her in that role, being my supervisor. But anywho, yeah, I was there and I was able to actually develop a comprehensive curriculum for sexual health education for teens. And so I literally had to go from start to finish, from the ground up, creating an
Hmm.
entire curriculum, with the action plans and everything like that, detailed. all of the good stuff in there about, hey, we're going to go from day 1 to day 30 in this whole class series. Day 1, we're going to talk about healthy relationships. Day 2, we're going to talk about safe sex practices and contraceptives. Day 4, we're going to talk about teen pregnancy prevention and the whole gamut. So it was really cool. It really challenged me to think deeper into, how we can address, it was more so teen pregnancy focused. So how I can address teen pregnancy prevention and what do teens really need inside of a comprehensive curriculum.
That's a really cool project. I guess maybe trying to reflect on that experience, what were some of the more difficult things that you had to learn in building out this curriculum?
I unfortunately didn't get to talk to as many teens as I would have liked to while developing it, but I was able to talk to a few young folks while developing that. So I think that was a bit of a challenge, kind of like not knowing all of the ins and outs of what they would want inside of the curriculum, or what would work for teens, right? And of course, not all teens are the same either. But that was kind of a challenge. It was me just kind of working alongside my supervisor, developing it. Uh, I was able to utilize some research and things like that to put into the curriculum as well. But yeah, I think a little bit more of the feedback from teens themselves would have been helpful.
That makes sense. Regardless, I think that's a really awesome project for a master's
It was
student to
fun.
be able to
Yeah,
work on. Yeah, that
for
builds out
sure.
a real like good set of skill sets and uses a good set of skill sets to do that. So that's cool.
For sure.
Did you have any takeaways that you wanted to share from your master's program?
Takeaways, definitely staying in touch with professors. And I think I saw a question later kind of about like some advice for students. I won't say all of that part of it, but um, not utilizing, developing relationships with professors, I think, because I ended up actually having a pretty good relationship with one of my teachers at the time, and he later became my supervisor when I ended up working later on at APLA Health and HIV work. And so that proved to be very valuable. Really going to those office hours, so they know my face, asking questions in class. And I am a little bit more on the introverted side and kind of quiet and things like that. But I really had to challenge myself to let the professors know, like, hey, I'm here. I'm ready to get this degree. I want to work in public health, and I'm ready to go. So definitely pushing myself to do things like that. But again, meeting with the professors and letting them know, hey, I want to work in this field. And that, like I said, it opened up a door for me later on. So that was pretty valuable. And then also kind of like the Bachelors, being involved on campus as well. So I was definitely involved in some public health clubs during my MPH too.
Before you worked under your professor in APLA Health, you were a teacher's assistant at the Los Angeles Unified School District. So tell us about your experience being a teacher's assistant.
Yeah, so no public health work in that role, but yes, I was there.
Technically speaking.
Right, right. So that was interesting. Working with the little ones. So from kindergarten to fifth grade on that campus, and just literally working with all of the different classrooms at the time, going from K to third grade, fourth grade, split classes back to second grade. I think I worked in every single grade during my time there and just helped the teachers out. It really was eye-opening. I obviously didn't have kids at the time, but I was like, oh my gosh, this is hard. Kids are very interesting people, I'll say, and I give props to anybody who's a teacher. My mom is a former teacher, and I'm like, I do not know how you do it, but anyways, definitely a good experience there. I mean, kind of a public health part of that was food. Oddly enough, I would see the kids leaving behind the healthy foods on the sharing table. They had this little sharing table in the lunch area, and they would, put stuff on there that they didn't eat or didn't want. And every single day there'd be like apples, bananas, pretty much fruits, right? Just kind of sitting on that table. And of course, the kids are eating all the other processed stuff. And it was really interesting to me. I always said I wanted to develop some kind of program while I was there to, like, use all of that stuff from the sharing table and maybe show them like what they could make with it and turn that into something fun. But I'm not gonna lie to you, I was so busy in my MPH program. I was like, I didn't have the capacity at the time to really implement something like that. Looking back, I'm like, man, that would have been really beneficial to really show them, hey, you can eat healthy and it could be fun, like make some little smoothies or something. So yeah, it was a good experience.
Yeah, and I've heard similar situations where people have seen like that the root causes or like the health education around the food come up as an issue when they were working in a school setting, and then that spurring them to get into public health as well, which
Wow.
is
Wow.
interesting. Yeah, yeah.
Yeah, yeah. All
And
roads lead to public health.
hey, it can if you wanted
It,
to. That's for sure. It's
that's for
definitely
sure.
able to be transferred and used, and skill sets are very valuable in many places.
For sure.
And so you said you were working under your former professor at the time as a linkage to care case manager at
Yes.
APLA Health. What was your focus there, and how did it inform your later work in HIV care coordination and case management?
Yeah, yeah. I absolutely loved that job. Like I came into work just excited every single day because kind of what I was saying about that one-on-one work and the counseling and things like that at the teen clinic. It was the same here, where I literally had my own caseload of clients who were diagnosed with HIV. And the program was set by the state. It was really for recently diagnosed folks with HIV/AIDS, but we saw everybody, right? We didn't turn anybody away. So folks would come in and were like, hey, I've had HIV for 30 years, or, since the beginning, or I've had it just since last year. So we saw everybody. But yeah, I definitely had my own caseload. It was a lot of social work, actually. I would meet one on one with the client that would come in. The main goal of the program we were in was to link them to specialized HIV care within 30 days. Of course, we would link them that same day, because all it took was, hey, call over to the clinic that we worked with, let's get this client into that appointment, and they would be ready to go. The challenge was retention in care. So, are they coming back for their follow up appointments? So, that was more of the challenge there. Getting them linked to care was no problem. But another thing was that since it was so related to social work, they of course would come in and they needed other services, right? They weren't just like, okay, cool, I'm linked to care, no problem. No, they definitely needed other social services. So, health fresh benefits, um, Medi-Cal, things like that. And luckily, in-house, we did have other departments where we can just do internal linkages. So we had a housing department as well, food bank, and all of that right on site. So we were able to go ahead and just get them linked to those services too. Um, and again, the program was set up for that to be like a one-time case management situation, but again, we're never turning down anyone. So I would have a few folks come back like, hey, I actually need this help filling out this Medi-Cal form. And I would sit there and help them fill it out, even though that was not in my scope technically. But I'm not going to turn them away. So yeah, I absolutely loved it. And just knowing that I could help one person even get some linkages to care and needed care was really life changing. I loved it so much.
And then after this role, you became a case management specialist at Planned Parenthood of Los Angeles. How do you come across this, and what do you do in that role?
Yeah, so unfortunately, the grant funding at APLA had ended with our Linkage to Care program. So I was looking for other opportunities, came across the Planned Parenthood one. I had always wanted to work at Planned Parenthood. So that role came up, and it was very similar to the APLA role where we were doing the counseling, health education with folks. But at Planned Parenthood, it was more so folks who were recently diagnosed with all of the reportable STDs. So, really providing that health education to them, primarily over the phone, actually. So, it's a bit different. Health education, information about partner services. So, you know, any sexual partners they may have had, letting them know that they can come in, they can get tested as well for free. They can get condoms and all kind of services that they need as well. And there's a little bit of contact tracing too. So I got to work a little bit with the infectious disease, what is it called? I want to say like a CDI, community disease investigator, I think. I'm horrible at acronyms, but I want
Makes
to say it
sense.
was a role like that, where the investigators would go out and like find the folks that maybe weren't coming back to care and all of that stuff. So working along with them, making sure folks are getting tested on time and all of that. So yeah, that was a really great opportunity as well. It was a temporary position, but yeah, I really loved it.
And was there anything that stood out to you working with this specific population?
What stood out was the inequities. Definitely saw just a lot more brown and black folks coming in. Well, this is a good thing though. They were coming in for services. I can say that's a positive. But I always wondered like what's going on in terms of like the access, right, to care. What's going on with this higher prevalence of STD rates that we're seeing in this population? So in the back of my head, that was always like, okay, well, why, right? And I knew why. There's inequities, the access, the education, and all that can only go so far out to certain populations because it's, the systematic thing, systematic inequities and all of that. But that was an eye-opening experience for me to really look into those charts and start seeing those patterns. I'm like, okay, this is definitely impacting a certain population more than others. So yeah, I'm always asking the big question of why.
Yeah, it's absolutely an important question that we like. I feel centers a lot of the work that we're doing in public health and like gets to the answer that like community is the why and like why are they in that position and how do we create the solutions for that, right?
Right.
You were also an infectious disease care coordinator at Saban Community Clinic. You coordinated care for patients with HIV and Hep C. What challenges did you face and what impact did you have in this work?
Yeah, yeah. So in that role, the infectious disease clinic was brand new at Saban Community Clinic at the time. I was the first person to be in that role that
Mm,
I had. And so there was a lot of kinks to work out, right? The goal, of course, was similarly to my Linkage to Care role at APLA, where we were getting folks linked to specialty HIV care, social services, and all that good stuff, providing the health education and all that, but the structure was a little different. We were finding that there was just kinks along the way. So what was different about this role is that it was clinic. It was a clinically based role versus APLA. It was more of like an office setting, face to face with folks. And so in that role at Saban, I didn't see as many clients as we would have liked to see. I think again, just figuring out what that clinic flow was supposed to be. So for example, patient A comes in, they meet with the infectious disease doctor first, and theoretically, they would come to me. And then I'm kind of, asking them more of the questions about like, hey, what else do you need from us? Do you need transportation? What other barriers are you having maybe to coming back, right? And making sure you're getting your HIV medication, you're getting your Hep C medication, etc. So I was almost like the liaison, if you
mhm.
will, in that role. Um, but again, there was just a lot of hiccups, I think, clinic flow wise. And I did work along with my supervisor to create better clinic flows, try to work with the providers as well, to see, hey, like what exactly are you telling them after the appointment? What are you talking to them about during the appointments about HIV and things like that? Um, so it was a challenge, but it was kind of exciting because I was able to create this EHR, electronic health record system, embedded questionnaire that the providers could then ask the patients that were coming in and wanted to receive services at the ID clinic. So questions in there about just how are they getting to the clinic? What other services do they need? Just all the social determinants of health type questions, right? And so that was a cool experience to be able to embed directly into the EHR system. That way, by the time they were coming to me, I can literally look in there and say, okay, I see you need X, Y, and Z. Let's see how to get you there. Let's get you over to case management. Let's get you over to, any substance use services or things like that. And so, yeah, it was a good learning experience overall.
And after this experience, you took a career break, I believe, for relocation reasons.
Yeah.
How did this I don't know impact your career, or like maybe help you to reflect on life?
Yeah. So at the time, I was only there probably about 6 months, and then my husband got a job in Sacramento. And we knew we wanted to leave LA eventually, but that opportunity came up, moved out here, and I was just looking for a bunch of jobs. But yeah, during that time when I was job searching, it really allowed me to narrow down my focus. Like, hey, what do I actually want to do? I didn't want to, I put a lot of intention into it, basically, is what I'm saying, right? I didn't want to
Mhm.
just take whatever public health role that came about. I wanted to be more intentional. I knew I still wanted to be in health education at the time. So when the health educator role popped up at Sacramento County, I jumped on it. Luckily, I got it. And, the rest is history. Been there 6 years now. But yeah, during that time, I was able to reflect on my past experiences too, and just um, the growth over that time, right? Where have I come? How long have I come? How far have I come, rather, from my MPH to now, and all of the roles that I've had, and how can those roles directly impact my current role at the time, health educator, right? So yeah, it was tough. That transition was tough, moving to a city, not knowing hardly anybody, and starting over again. But yeah, it ended up working out in the long run.
Yeah, absolutely. And maybe like reflecting on, because I like the idea of not just choosing any role, but choosing roles that like resonate with you. What was that kind of process for you to kind of whittle down to say, like, these are the things that are important for me in a role?
Yeah, I knew I wanted a role where I could make direct impact, and preferably a role where I was able to meet with the community, be with the community, whether that be going out and doing group education classes or even 101 uh, classes and things like that. So I knew I wanted to not just be behind a desk, right? I didn't want to just do computer work. Um, I realized like the further I kind of go up in my career, it is unfortunately becoming a little bit more of the computer work. But
Hmm.
anywho, yeah, that's what I was focused on at the time. I definitely wanted to be directly in the community, seeing what their needs were, providing that health education, and really just making that, I guess, more direct impact, if that makes sense.
Yeah, absolutely. So you said that the role that you were able to get was the health educator role at Sacramento County Public Health. Tell
Yes.
us how I guess, yeah, tell us the process of getting that role, and what did you do in that role initially?
Yeah, yeah. So I was hired on for health educator role in the tobacco prevention program at the time. In that role, it was actually a little bit of policy work, but I later realized I didn't love that side of public health so much. It was a lot of policy work, but I did learn a lot. It was kind of cool. We were able to go to like the city council sessions and things like that to see what the community was saying, because at the time, the city of Sacramento wanted to ban flavors in vaping products and tobacco products. And so I came in right in the heat of that. So that was kind of cool to see. We were able to see how the community felt about it. They were giving their direct feedback on it. We were sitting in, we were taking notes. We really wanted to understand um, both sides, really, right? Folks were coming in like, hey, this is going to impact my business. If I have a vape shop, if flavors is banned, that's 80% of my inventory. How am I going to make money? So it's like, okay, I can understand a business owner, but right. Um, some folks are coming in like, hey, like, I understand you guys want to eliminate these tobacco products, but I that's how I manage my stress. I smoke, right? What other strategies are you going to give me to help me manage my stress? The job, things like that. So hearing both sides was really, really interesting. Hearing all sides was interesting. So I came in the thick of that, and I was able to do a lot of community outreach involved with tobacco education, and like I said, seeing that policy side as well.
That is fascinating, and that's, I think that really paints a picture of like how nuanced the work that public health is. And like, yes, because just because people say, oh, tobacco is bad, it's bad for you smoking, doesn't mean that's not what someone like wants to do and is healthy to them because it's reducing their stress and they have nothing else going for them in life, and
Right.
to take away this one thing is, yeah, so it is
Yep.
very nuanced conversation in a lot of
Yeah.
ways.
Yeah. I learned that, like, a lot of folks with mental health conditions utilize tobacco products to minimize their symptoms and their stressors, right? Because it's like that fixation of like, hey, I need to be fidgeting with something. I need to, that oral fixation of like smoking and things like that. So it really, it opened up my eyes to what people are experiencing.
Yeah, absolutely. And so you've been with Sacramento County for a while now. You have had many roles, going from the health educator in the tobacco program to now human services program planner. Can you maybe walk us through some of the highlights from going there? Because I know you were also a nutrition health educator.
Hmm.
And then tell us about what you do currently.
Yeah. Yeah. So started out in tobacco education, as I just talked about, and then went into our CalFresh Healthy Living program, also known at the time as Obesity Prevention Program. Help them with that name change. So I was there for a couple of years. As I was doing a lot of contract monitoring in that role as well. So working with community-based organizations, helping them meet their grant criteria and all of that, making sure they're on track with their goals, objectives, and all of that good stuff. Community outreach, health education, and all that. COVID did kind of put of course, a little pause in things. We couldn't go out in the community as much. We pivoted a lot to virtual education and things like that. Worked a little bit actually as a what was the title? I want to say emergency services worker at the county during COVID. So kind of threw that a little bit in there as I was a health educator as well. And so then last year, I actually became a human services program planner in the maternal, child, and adolescent healthcare program. And so in my current role, I serve pretty much as a support or liaison between all of the public health nurse home visiting programs at the county. So that we have something called community nursing, we have Black infant health, nurse family partnership, and really helping those programs recruit more members, basically, if you will, to utilize those services. In those programs, basically, what happens is our public health nurses go out, they do home visitation for folks that are just experiencing postpartum issues. Um, they might have children with special needs, all of that good stuff, and they're really those nurses really go in and they're addressing all the social determinants of health and all of that. So I support those programs, their reporting and all of that. I also support the child health programs at the county as well. So that's our lead poisoning prevention program, as well as our oral health program, which that part's kind of newer to me. I just signed on to time study to that program pretty recently. And we're going to be doing a community needs assessment. So it's really just supporting all those different programs. Look like developing educational materials one day to doing a training for OB providers the next day. A lot of it is reporting as well. So making sure, hey, we're gathering our data, we're compiling it in this fashion. We're actually working right now to better integrate our data, or actually not integrate, excuse me, extract our data from our electronic health record system and put it into a different platform, or kind of figuring out a better system for that, for all of the field nurses that go out and actually do the home visitations, if that makes sense. So yeah, I'm pretty much like the go-to person for all of those programs in a way, right? The non-clinical person that helps with all of those programs.
And looking back on your career at Sacramento County, what do you think like has allowed you to have a flourishing career at the county?
I think honestly, flexibility, rolling with the punches. I don't know if you've worked at local government before, but there is a lot of just red tape and some things you have to kind of play the game, if you will, right? And so really learning how to navigate those spaces, playing the game, um, jumping on opportunities as they come around. So things will things will pop up like leadership trainings and other opportunities like that. So trying to jump on those, volunteering for various community outreach events that came up was really an opportunity for me to, keep showing my face and saying, hey, not only am I a health educator, right, but I'm really committed to this work and just showing up every single day. And I'm not gonna lie, like I think I mentioned a little bit about like I'm a little bit more shy or introverted, and that comes across in the workplace as well. Um, I really had to find my voice, I think, at the county along the way. I really had to learn these programs, especially the CalFresh Healthy Living program is very nuanced. There's a lot of moving parts to that program. And I also have ADHD, so I'm neurodivergent. So that's another layer on top of things. So the way I take in information is that I have to kind of sit with the information as it comes, review it, reflect on it, and then I'm more confident to then speak on issues with the program, right? I'm not the type that's going to just initially jump at something or be super vocal at first. So I guess I'm saying all that to really say that I had to navigate that as well on a personal level in my career, and being a Black woman who's neurodivergent, right? So all eyes are on me in terms of how I show up in the workplace. So, yeah, navigating all of that, working really hard and showing up, bringing my authentic self to the table and bringing my passion to the table as well. My passion and love for public health has really, really helped me along the way. That was a long answer. I'm sorry.
No need to apologize. What excites you most about the work that you do?
What excites me the most is the people I get to serve. Again, like I mentioned in this role, I don't get to do as much community stuff, but I do get to do, different trainings and things like that. I know that it's making some kind of impact, but what keeps me going is keeping that in the back of my head, right? Knowing that the work that I do, the work that I've done is impacting communities, whether it be just a little bit more indirectly than my previous roles, knowing that someone is getting this information, right? So let's say I do a training to OB providers and it's teaching them how to help their patients utilize our child health services, right? I know that that's going to trickle down to those families that are utilizing those services. So that could result in one less child, getting lead poisoning in their home, right? Things like that, I just try to keep in the back of my mind at all times and realize that, even that one little drop in the bucket is making a difference. Yeah.
And tell us about that public health chick.
Yeah. So that public health chick came about during COVID. I was literally working at the COVID testing site as the emergency services worker with all the PPE on, the mask and everything. And I don't know, it dawned on me that I don't think I've seen at the time, at least, a lot of public health platforms on Instagram. Maybe I just wasn't looking for them. I'm not sure, but I just wasn't coming across a lot of them. And I'm like, well, why not me? Why can't I be a voice for public health on Instagram, right? One more platform that's available for folks to just get health education information. That's the original thought. I was like, I'm just going to share health education. That's what I'm going to do with this platform. So I just typed in the first name that came to mind. I'm that public health chick. And so I made the Instagram page, and the rest is history. It's grown. I can say that it has slowed down for me a little bit, just because becoming a mom and like my life looks different now. I'm super busy. I don't post as much as I want, but it's still one of those kind of fun things for me to be able to share information out to folks. And I was able to come up with my clothing line from that because, again, I hadn't seen too many folks come out with public health clothing and merchandise that's fun and relatable, right? So yeah, that's why I developed it. I had intentions actually back then too to do a lot of blog posting, but yeah, I realized that is not for me necessarily. Sitting there and writing, my mind's too scatterbrained for that. So, but anyways, yeah, I absolutely love posting on my social media page and reaching people that way.
Yeah, and I agree. There aren't enough public health platforms where people are just sharing about their experience, whether that's being a student, being a professional, talking about public health. And still to this day, it's nowhere. I feel like where it could be and should be.
True.
And yeah, and you don't have to like build a company out of it. But I think to your point, like just both like on the representation front, but also on like health education, you never know like how you tell your message is going to impact someone.
Right.
So
Exactly.
yeah,
Definitely. There's never going to be too many of us. I think a lot of people are like, well, there's already, I can't do that niche or whatever. Like, there's already too many people doing it. Nope, never. They're never going to have your voice. They're never going to have your exact
right.
lens, your experiences, your life experiences. So that's what I had to realize too. Nobody can be me, right? So, yeah, keeps me going.
Absolutely. One of my goals is to build an army of public health content
Yes,
creators.
and you're doing it
So,
like your brothers in public health platform. And yeah, you post a lot of good stuff. It's
yeah,
inspiring.
yeah, we getting there. We
It's
getting
amazing.
there.
Yeah.
And so you are also a postpartum doula at Empowered Roots Doula. Tell us about your journey into becoming a doula.
Yeah. So that's like my own little business, if you will, the Empowered Roots Doula Care services. I'm just getting that off the ground. I'm working on building my contracts and stuff right now. So I don't have clients yet, but I am a trained postpartum doula through CAPA, and I'm working towards certification. A lot of folks I don't think realize you don't necessarily need to be certified to be a birth doula or a postpartum doula, but I think it looks a little better, right, to be certified in those spaces. And so, yes, I'm a trained postpartum doula, and what I will do is work with families, of course, in the postpartum period or the fourth trimester, I call it too, and really just help primarily the mother or birthing person get through that period. We don't want to come in and just take over the role and say, okay, give me your baby. I'm going to do everything. It's really empowering that parent to learn how to parent, right? And learn how to also take care of themselves in that postpartum period and offer just any support that they need during that time. So that includes like maybe a little bit of meal prep. Maybe that does mean holding the baby while the mom or a parent takes a shower, right? Just those simple things. A lot of postpartum doulas do like night care. So let the parent sleep the night. The postpartum doula comes in and takes care of everything. So that's what my intention is. I just want to share a little bit about what a postpartum doula is, because I don't think it's really talked about as much as a birth doula. So yeah, definitely getting that started, getting that off the ground pretty soon.
That's awesome. Well, for obvious reasons, I'm not in those circles as much
Yeah,
as you'd imagine.
yeah,
But
understandable.
I know that there's a lot of importance and a lot more conversations going on in, and you say like that fourth trimester, and I think
Right,
even like the trimester before, I guess considering before the birth or the conception is even happening as well, and
right. Yeah,
considering all
preconception too.
right preconception. Thank you,
Yep.
thank you for the words.
So
Appreciate
much
that.
terminology.
Right. Okay, so before I move you on to the Furious Five, the past guest left a question for you, and the question that they left was, "What's one thing about your career that you didn't expect?"
Expect. Hmm. I thought of this one too much. And coming into the county, I'll say, and this is not like bashing or anything, but I think the lack of creativity that I have in some of my roles that I've had at the county, um, I wasn't expecting that. That was a little hurdle, and I'll say it's because coming from the nonprofit world that I worked in prior to the county, right? So working at APLA Health, for example, working at Saban Community Clinic, I did have a little bit more creative freedom and saying, hey, let's try this. Let's create this flow chart and see what works. Like, let's try this with our patients. Let's embed this survey. Let's do all these things. Let's do this kind of outreach and all that. And then coming to the county, especially the program I went into with nutrition education, it's very structured because it's state run, right? I mean, we get our funding from the state in that program. So very, very structured and tailored. So I really had to kind of take a step back and realize, okay, I have to just abide by these set of rules and these guidelines and things like that. And I can't really step too much out of that. Um, because I was coming up with all kind of ideas. I was like, let's get t-shirts over here. Let's do this type of outreach at this place. And I'm like, no, you can't do that. And it became a little daunting at first. So yeah. But again, just like really learning how to just kind of push forward, and you can still have a creative voice in a way, but I guess kind of figuring out how to not, I don't know. Yeah, I don't know how to end that
No,
question, I guess. But
no,
yeah, please
that's
edit
good
that.
insight. No,
Yeah,
I don't think there's any need to edit. I think that's good.
please do.
Good.
But yeah, figuring out how to navigate that, I think, was pretty challenging.
Yeah, understandable. But that's a good insight though. And moving you on to the Furious Five questions that I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
Yeah, I think definitely. I think I touched on it a little bit when I said to get to know your professors. Definitely, maybe even a professor that resonates with a certain class that you, or that resonates with what you love, or a certain class that you really enjoy taking, right? So maybe if you hate epidemiology, maybe don't get too much into epidemiology, right? As a professor that you talk to. But yeah, getting to know your professors, meeting them, getting involved on campus, and just really talking to other students that are in your program, seeing what they're doing, seeing what their passions are, what they're planning to do after graduation. Um, Try to get into those internships that are available. I'm seeing a lot of internships now that are paid. That was like not really a thing when I was in school. I have to tell you that, especially in LA. It was really hard finding paid internships. I think that's shifting a bit, which is great. So finding that internship, right, that maybe aligns with the area of public health you want to be in. I guess also find the area of public health you want to be in, right? Figuring out what resonates with you. So, like for me, I knew for a fact that I did not want to do anything with math or formulas or anything. So I knew, hey, epidemiology or stats, I'm out. But community-based health education, health promotion, and all of that, I'm in. So really figuring that out for yourself, figuring out what resonates with you is your personality as well. If you know that you hate presenting to the public, maybe you do want a role that's a little bit more in the background, right? And then also, I think this is something that I wish I did, was finding a mentor. Uh, that could be really, really valuable in your career later on. I mean, I guess it's never really too late to find a mentor, right? But finding someone that maybe has a role that you want to be in, um, setting up maybe an informational interview with that person and saying, hey, like, are you open to just chatting with me a little bit and seeing kind of what I could be doing to maybe eventually get to where you are? Give me some advice if you don't mind. And also, yeah, just try to make those relationships happen.
If you're talking to someone wanting to get into your position, what advice would you give them?
I think talk to me, right? I mean, like I said, like the informational interviews are really great. I've had a few folks actually reach out to me about that, to do like a remote or virtual one. A lot of folks from different cities and things like that. And just literally asking questions. Hey, how did you, kind of like what you're doing here with me, right? How did you get into this role? What is your journey like? What are some classes I could take or a certification that I could take that might guide me into a role that's like yours, and really just, I think meeting people and networking. I know people always say networking, which is actually a bit hard for me because I'm the type that's really going to go up to people a lot and say, hey, I'm Nkechi, but I'm working on that. But yeah, anyways, networking is really valuable as well. Um, so, oh, but you asked how to get into my role. More so, I think the informational interviewing and really asking questions.
Number three, what's something you're working on improving in your life right now?
I know everybody probably says this, but self-care. I'm really, really trying to hold more space for that, especially in this landscape. I'm not going to lie to you. Um, the first part of the year was dark. Like I was pretty depressed with this administration, and what's going on. And it's already hit home for me, a lot of the decisions that this administration is making. I have a mom who's a senior who is on Medicare, right? And so it's already at our doorstep. So I'm saying all that to say self-care is a priority for me. I'm a mom of a toddler, with a little boy with a lot of energy, right? So trying to find time for myself is very key for me right now, and that includes a little bit more exercise. So I think, I got to practice what I preach in terms of public health. We always say, work out for 30 minutes a day. So I'm at least starting there and, making time for that.
Number 4, professionally, do you recommend anything?
Like a book or
Yeah.
podcast, something like
Mhm.
that. Yeah, yeah. I definitely recommend your podcast because
Thank
it's
you.
amazing. But I'm really into audiobooks right now. I think as someone who, like I said, has ADHD and an attentive type, it's really hard for me to sit and read full books, like really long books. So I do a lot of audiobooks. So I do recommend, especially for public health students, to read Medical Apartheid by Harriet Washington. It's probably one of my favorite books. It is hard to get through context wise, just because it talks about such a dark past, right? But that is one of my favorite books in that genre. The Immortal Life of Henrietta Lacks is amazing. I think that should be required reading for all medical and public health students. So, those HeLa cells, it's probably why we have most vaccines we have today. Um, what else? Yeah, those are two big books I would say that I recommend.
Great works. And number 5, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
Ooh, it would be to do not worry, you will find your voice. I mentioned a couple times that I was extremely shy as a kid, like very ancient, like social anxiety. Went through a period where I just did not want to talk, you know what I mean? So I feel like I didn't have a voice. I just was kind of floating around, listening to what other people were saying, listening to their voices. And now my mom always jokes around with me. She's like, "Nope, you found your voice." Because she's like, "You will let it be known when you don't like something or when you want to get your point across." So you found your voice. And I tell myself, you will find your voice, and that might be through public health because that's what it's meant for me. I have a voice through public health. I want to empower communities with my voice, help make things healthier with my voice, utilizing going by my life experiences and sharing that out to other folks as a voice. And even if I can just have one person with my voice, with whatever I'm doing, yeah, that's what I would probably say to my younger self.
Well, Nkechi, thank you so much for coming on and sharing your story, your expertise. Your voice is definitely going to be heard and resonates with many people. So I appreciate you taking
Thank
time.
you. Thank you so much. I had a good time.
Truly is my pleasure, and I'm glad to hear that.
Thank you.
That makes my day. Housekeeping
Yay.
items, everyone. Thank you so much for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a like, leave a review, and share this with a friend who gets some value from it too. Greatly appreciate you all. Peace. See you all next week.
Bye.